Thank you for joining me from Sava Hicks VA Hospital. This is your physical therapy department. Today we'll be talking briefly how to use a TENS unit safely. For those of you who don't have prior experience, a TENS unit is a small electrical device to manage chronic pain. When done so, it can be quite effective. Along with the TENS unit, you'll receive all the other equipment you'll need, including the electrodes. The electrodes are sticky patches that make contact with your skin and need to be replaced periodically. As they dry out and stop sticking to the skin, you can simply contact our prosthetics department. Their number is listed on the sheet. I don't advise you use a TENS unit if you have a cardiac pacemaker implanted. If that's the case, you'll want to speak to your primary care provider to discuss other options. When placing the electrodes, you want to keep it away from areas on your face, your head, the front of your neck. Also over your heart, on your genitals, or directly on your spine. We ask that the skin be relatively clean of any lotions, oils, or muscle rubs. That includes medicated topical rubs as well. If you have further questions, please feel free to contact me directly at 520-792-1450, extension 2103. Thank you. Okay, so you may have received your TENS unit in the mail, or you may have picked it up here locally. Either way, it's going to come complete in this pack here. What we want to do is go ahead and open it up. You will retrieve the TENS unit, which is a small black device with a screen on the front. The first thing we want to do is make sure we get the batteries inserted. So we'll retrieve those from the pack and from the cellophane. You can feel comfortable, go ahead and place those in the unit itself. Now remember, these are the rechargeable ones provided by the VA. So you want to make sure we charge that about once a week or so. The next piece of equipment you'll want to retrieve will be one set of lead wires. We'll go ahead and open up that bag. We'll take off the black twist tie. We'll just kind of get that wire elongated. We'll notice that the wire has two ends, one with some exposed plugs, one with a right angle connection. We're going to take that right angle connection and insert it right into the top of the unit, just like so. We're going to go ahead and do that for the left and the right side. And you can feel comfortable sort of elongating those wires, getting the twists and turns out of them. Also, we'll notice that each side, each wire has a clear plastic wire divider there. If you'd like, you can slide that down maybe another 8 inches or so. That way we can expand those wires as needed. So again, we have the batteries inserted. We have the lead wires inserted into the top. Now it's time to retrieve the electrodes. Now remember, these are the sticky patches that make contact with your skin. The cleaner your skin is, the longer these will last. So again, we'll go ahead and open those up. Now for some of our smaller treatment areas, you may only want to utilize 2 electrodes. But for areas that are larger, we may want to utilize 4. For today's purposes, we'll just be utilizing 2, but the rules still apply if we're using 4. So we'll go ahead, bring our attention down to the exposed wires, and just as you can imagine, we'll make good contact into the white connecting piece of the electrode. All right. Now once we have 2 or 4 correctly connected, we'll look at that area of pain and we'll ask ourselves, how do we want to place that? And again, as long as you're bracketing or surrounding the pain, you're doing it correctly. Today I've identified a place on my arm as a test site. So that'll be the site of pain. we'll simply take the electrodes off of the cellophane, make good surface contact with your skin, making sure all four corners are pressed down. We'll set that cellophane aside. So once we have the batteries inserted correctly, the lead wires are hooked up, and the electrodes are placed on the side of pain, we can feel comfortable bringing our attention over to the TINS unit. We'll open that up. First button you'll familiarize yourself with is the large circular power button. We'll tap that once and the screen will come on blue. Now if we were to tap that quickly, we'll notice that it locks and unlocks the screen. You'll know that because the letters LOC will be identifiable on the screen there. So we'll make sure that it's unlocked. Once we have it on, we'll bring our attention over to the mode. Now the mode informs the machine of the particular parameters that you're going to use during that treatment. You can feel comfortable using any mode you like. You can also change that mode about once a week. Once we have a mode that we feel comfortable with, we want to bring our attention right below that to the clock button. And in increments of 15 minutes, you can set your treatment duration. So once we have it on, we have the mode set and the time set, we're done with that bottom portion. We can close that up. Now we're going to bring our attention up towards the intensity dials. Now recognize that there is a dial for each wire. And since I'm just using the two, I'm going to bring my attention over to that dial. And in a clockwise fashion, I'm going to bring that intensity up little by little. Two things you'll see when you do that. You'll see the intensity bars come up on the side there. You'll also see a small yellow LED light up, letting you know that that side is on. And even more important, you'll start to feel that pins and needles sensation. Now a question you might be asking yourself is, how much is enough? And that's going to be a case-by-case individual answer. A guideline should be, it shouldn't be so strong that you can't talk or conduct normal activities. But it should be strong enough that you're feeling the sensation from the unit and not the pain, at least not as intensely. Okay. Once you have the time set, and the dials are covered back up by the protective cover, you can feel free putting this in your pocket or on the chair next to you or on your belt. Okay.